And okay, great. So I just want to officially and more formally welcome you to our web conference today. You're joining us for Introduction to Data Sharing and Integration to Advance Sexual and Intimate Partner Violence Prevention. We do have some objectives for us today that were provided by our wonderful presenters, who I'm very excited to introduce you all to in a few minutes. But really, we're looking to be able to gain a deeper understanding of how cross-sector data can transform information about individuals into actionable intelligence that can be used to understand needs, improve implementation, and build stronger, healthier, and more just communities, and to be able to describe the core benefits, limitations, and risks inherent to administrative data reuse. And I just want to pause for a moment and say that, you know, as the title says, this is very much an introduction to data sharing and integration. There's actually not a lot of information out there about data sharing and integration to support specifically sexual and intimate partner violence, at least in the US. But there are some lessons from community violence prevention and supporting youth that are really relevant to our work. But we still thought that this was a really important conversation to start and explore, especially given how many of us are implementing health equity and cross-cutting approaches to our prevention work. So I think that our goal for today is really to provide a knowledge base and to start thinking about how data sharing and integration may support sexual and intimate partner violence prevention. So this may not be something that you'll walk away from today and be ready to engage in anytime soon, but if nothing else, I hope this conversation will inspire us to think about the possibilities. So with that, I want to just start with a moment of truth. So let me launch a poll briefly. So you should see this poll pop up on your screen. And I'm wondering how you feel about data. I'm guessing that most of us didn't get into this work out of a love of data, unless you're an evaluator, and maybe that's exactly why you're here. But regardless of all that, you know, we do use data a lot in our prevention work. So how do you feel about it? Do you love it? Do you respect it? Do you fear it? Janae, people are responding. I like to wait till we get about 70% of participants to close the poll. And I'm wondering, can I ask you how you feel about data?
Yeah, I'm looking at these early results of the poll. I'm very impressed that very few people have a fear of data. I do, or did, maybe kind of do. I came into this work, I was a journalist and then a community organizer after that. And I think especially being at a small rape crisis center as a prevention manager, I thought that data just meant evaluation. And I didn't understand it at all. I knew, big picture. I know I would use data to help tell my stories, but anytime anyone mentioned data collection or data using and prevention, I would be like, I already have 10 jobs. I can't take one more job. And underneath that, I don't think I'm smart enough for data. That has since changed in the years that I have done this work, but for a long time, and even still, sometimes I have mad imposter syndrome when it comes to data.
Thanks for being truthful. And, I appreciate everyone's responses. I am hopefully sharing the results so you can see how others in the room feel about data. There's 4 of us that have a fear of it. And I can say that I've definitely moved through each of these responses. And today I can say that I like it. I think it's incredibly important, and I don't always know what to do with it or where to find it. So my data journey continues to unfold. I'm going to go ahead and stop sharing that. Thank you again for participating in that. So no matter what our current relationship to data is like, if we're doing prevention work, we do use it a lot, both to make, I would say, internal decisions and to communicate externally about prevention and violence. And I think, just the first thing that you learn when you start doing this work is that data helps us understand the prevalence and the impacts of sexual and intimate partner violence. And the National Intimate Partner Violence and Sexual Violence Survey, or NISVIS, is probably the most commonly used source of data for us to understand the scope. But we also use data in planning our prevention approaches. We can use it to identify communities that are most burdened by violence and then focus our efforts there. We use it to identify, select, and evaluate strategies, and we can also use data to inform policy level strategies. And even if you aren't using data for any of the things I just listed, you are likely still collecting it for funders. And sometimes that is our only relationship to it. So another question for you all is, I'm wondering, how are you most commonly using data in your prevention practice currently? So we'd love if you head over to the chat and just let us know, how are you most commonly using it as you go through your day-to-day work doing prevention? Janae, can I ask you to just briefly share how you've used data in the past or how you're currently using it?
Yeah, thank you, Ashley. And this really goes with my journey with data as well. I think right now I'm using data the most to make connections for health equity and why we need to uplift and implement health equity in our work. I'm thinking especially about June and Pride Month and all of the challenges that we're facing around anti-LGBTQ rhetoric and inclusion, and really making the case within the field that LGBTQIA justice, that racial justice, that immigrant justice is sexual violence prevention. And so I have found data and storytelling and shifting to at least my internal view of storytelling about how those issues are connected to our work, and how working in the intersections of violence and prevention also prevent sexual and intimate partner violence has probably been the thing that I go to most often and the thing that I get requests for most often.
Great, thank you. Well, and I see some very similar things coming up in the chat. So people are using it to look at policy solutions, lots of evaluation, lots of looking for trends, improving programs, prioritizing areas, lots and lots of different ways, equity goals, research, community advocacy, grant funding. So there's lots. Data drives decisions on what our needs are. Thank you so much. I'm going to have to pour through these because you all have provided so many examples of how you're using data. So really appreciate you sharing. Continue to share in the chat. Again, that's one way that we can connect with one another. I think it's fair to say that there's a lot of information being collected about the occurrence of sexual and intimate partner violence, and there's lots and lots of data sources we can choose from. But we also know that violence is connected to many other issues, including other forms of violence, and we actually have much more limited data available that helps us understand the full and complete context of victimization and perpetration, including, wanting more information on risk and protective factors. And so it isn't necessarily that additional data that would be useful to us doesn't exist, but rather that it's not being shared with us or we're not accessing it. And so that limitation doesn't allow us to see the complete picture of the burden from sexual and intimate partner violence, and it can also really hinder our ability to select appropriate prevention strategies. We talk a lot about the importance of cross-sector partnerships in prevention, and that's because a vision for safer communities requires the involvement of many different sectors, many people. And, we say this a lot on Prevent Connect, that there's no one sector that can prevent violence on its own. And as we continue to implement community-level prevention strategies, cross-cutting and multi-sectoral partnerships, that really becomes crucial for our success. And so because all sectors have their own stakeholders, champions, and networks, we can really bolster our prevention efforts by working towards common goals and having a wider impact. And one thing that tends to happen, our cross-sector partners and other issue areas that are connected to sexual and intimate partner violence, they're collecting their own data that could be very beneficial in helping us understand the broader context of violence. But often, like our programming has been in the past, the data is siloed. And so, data silos can inhibit our understanding of complex public health issues like sexual and intimate partner violence, along with the design and evaluation of collective impact efforts. And just to further help us start thinking about how data sharing may be useful in our prevention work, I wanted to share an example from CDC. And this is obviously not about violence prevention. This is about motor vehicle accidents. But what it does is it provides an example of data that could be shared from different organizations and agencies that are relevant to vehicles and vehicle crashes. And so the diagram shows different types of data that could be shared prior to a crash, data from the actual crash, and data post-car crash. And by sharing this data, protective factors could be identified and a more complete understanding of the context around car crashes could be understood. So data sharing can really broaden the scope of prevention and also improve the collective impact across our cross-sector partnerships. And Janae, just want to throw it back to you and ask you, when you're looking at this diagram, again, this is like so far removed from violence prevention, but is anything coming up for you that makes you think about how we might use data sharing in violence prevention?
Oh, yeah, absolutely. I mean, when you were talking about cross-sector sharing, I think all of the creative ways that we can use data, drawn data to inform our work. I think when I look at this, I think about my local community and I think about how would I tell the story about the experience of a survivor of violence and their trajectory, or a perpetrator of violence and their trajectory. And that traditionally, we're drawing from the NISVIS survey, we're drawing from law enforcement data, we're drawing from public health data. That's all really great. And it's also really focused on interpersonal violence. And if I wanted to tell the story about the experience of violence in my local community, I would also be drawing on housing plans. I would be drawing on city priority goals. I would be doing mapping. I would want to talk to schools. I'd want to talk to kids. I'd want to talk to parents. It really makes me think about all of the holes, and things that we understand anecdotally. We understand a person's experience of violence through their lifetime and why things happen, or likely causes of why things happen. But how can you paint that picture visually for other people, and all the different ways that we can be drawing from things that we don't? And maybe it's because I'm a journalist, or, a journalist by trade and by experience, but it makes me excited and it makes me want to tell more stories.
Thank you. I love that. And you shared, I was thinking, okay, so we probably wouldn't be interested in getting data from the DMV, maybe, but we want to get information from school systems, from our local health departments, from workforce development programs, from housing. So all of the things that you said, Janae, were kind of possible people who hold data that might be relevant to our work to prevent violence. So thank you for sharing that. And I'm going to introduce you all to our guests now, but before I do just want to throw it back to our audience and ask you all, in thinking through this, what data would help you better understand the context of sexual and intimate partner violence? Whether you're working in a local community, you're working at a state level, coalition, or health department, what other data would help you understand the context better? And we'd love for you to just head to the chat again and just kind of brainstorm with us. We don't have the answers, but we want to just start thinking about this. All right, so I am very excited to introduce you all to our presenters today. Deja Kemp and Emily Berkowitz are from Actionable Intelligence for Social Policy and are experts in data sharing and integration. I had been doing some research on data, health equity, and racial justice and came across their work and thought, you know what, this is a new conversation, but it's a really interesting conversation. So Deja and Emily, welcome. Thank you so much for being here. I'm hoping that you'll share a little bit about yourselves and AISP and then walk us through some basics around data sharing and integration. And you both should be able to unmute yourselves. I'm also going to we'll stop sharing and you can put your slides up.
Perfect. Thanks so much. I will get those slides up and ready.
Well, while Emily is doing that, I'll go ahead and introduce myself. My name is Deja Kemp. As our lovely host stated, we are with Actionable Intelligence for Social Policy, which is actually housed at the University of Pennsylvania. We are a small team. I live and work in Charlotte, North Carolina. Emily is in Philly. And I am the director of legal policy. So I'm a lawyer by trade. Before joining AISP, which is our acronym for short, I was senior associate general counsel with this school district here in Charlotte, North Carolina. Before that was in private practice. And as part of my private practice, I assisted clients with getting protective orders within this context. So super excited to share a little bit about what we do at AISP, specifically about my job. I help people think through the legal issues and some of the legal barriers that come up with sharing integrated data to alleviate folks' fears. I am not a technologist. I do not do math, which is why I went to law school. So I absolutely understand the apprehension that might come from sharing data, and we hope to demystify it. But one thing you will hear from us about our approach is that we are people-driven. There are actually no data technologists or analysts on our team. So we're excited to share just our viewpoint and our entry point. So I'll turn it over to my colleague to also introduce herself.
Hello, thanks, Deja. So my name is Emily. As Deja said, I'm based out of Philadelphia, Pennsylvania, which I'm excited to give a little example later about what's going on in my community here, our community here. And my background is similar to Deja. I'm not a technologist. I'm not a math person. I am a social worker by training. And prior to going to social work school, I was a community educator at a prevention program in Poughkeepsie, New York, at the Grace Smith House, which is a domestic violence agency. So being with you all here today is quite special. I have big love for Grace Smith House, big love for Women Against Abuse here in Philly, and big love for all of the folks doing this really important prevention work. My role at AISP is a lot of network engagement. We'll talk a little bit about the sites that help us do and understand what it is that we do. But we talk a lot about administrative data. You'll hear some technical stuff today about how that works and the relationships that drive it forward. But even in our work, our primary way of evaluating ourselves is through a survey. So there's always so many different kinds of data and work that are flowing through what we do. So that's a little bit about what I do, and I will pass it back to Deja to kick us off.
Perfect. Thanks, Emily. So I'll talk a little bit about what we do at AISP. So these are all the buckets of basically the work. The foundation and hallmark of our work, however, is our peer network. So we convene and provide support to, I think the count now is 38 local governments. So that includes states, municipalities, counties, with data integration and sharing. We also produce some guidance and standards, which are available on our website. We do some training and consulting. So we do these type of things where we kind of spread the good word about data integration and sharing. We do some advocacy and communications. And then finally, we do have a few academics on our team who actually do some actionable research. So that's a brief overview of what we do here at AISP. Next slide. So it's also helpful to kind of clarify what we are not. So it's an initial matter. We do not hold data. We are not data holders or intermediaries. We are not vendors. We don't recommend any vendors. Again, you'll find that a lot of our approach is relational. We don't, there are different tools that you can choose from, but we don't advocate for any product or app. And we are not just focused on academic research. Instead, a lot of what we do is connecting folks to their peers, iterating on best practices. We like to call ourselves data evangelists. So again, spreading the good news about this type of work and how it can be used as a tool. And importantly, we're focused on ethical data use for policy change. So we're not just here for research sake. We really do view data as a public good and focused on how that can be used to benefit the public. So I'll turn it back to my colleague, Emily. Sorry.
Oh, that's an honor to be. Amy's another person on our team, so this is our approach. As Deja mentioned, we are really focused on relationships. We know that is what drives the work forward, is working together and figuring out what shared goals are. We've already mentioned that we're an interdisciplinary team. We also have other former teachers on our team. We have lots of social workers. Our faculty director is a homelessness researcher. So we all come to this work not because we're interested in technology so much as we're really interested in supporting data stewards, right? People who are going to better serve clients, and that being their main goal and the main purpose behind data usage, right? And that we really care about the people behind the numbers, not just clients, but whole humans that make up this work. So we have a lot of experience doing that. And just want to ground a little bit in the kinds of data that we're talking about when we talk about administrative data, right? We're talking about human service data. So that which is collected during the routine process of administering programs. Those are typically programs that are at, federally funded and then state and locally administered. I'm sure you're very familiar with all of these services. Interestingly, DMV data is quite popular in our network because it's at the individual level and gives us a lot of names it gives us a lot of people to connect to, right? But the beauty of these data is though they are collected for the purpose of program administration, they can be repurposed to support evaluation, analysis, research, engagement there. And that's what we're going to talk about is how that works. So, and Deja's going to tell us sort of about the seminal work behind that.
Exactly. Thank you, Emily. Another thing I wanted to highlight about what do we mean when we talk about administrative data? We are specifically talking about the use of data that has personal identifiers, so names, addresses, across most statutes that refer to anything that can identify someone. So this is part of the seminal work. So we are one of the founders of AISP. He is a professor here at University of Pennsylvania, is Dennis Culhane, and he is quoted extensively in this report that kind of was a new use to think about administrative data. I'm not going to read this whole article for you. I'm just going to flag a certain part. We can go to the next one. But what was interesting about this was in the 1980s, Professor Culhane, Dennis Culhane, when he was a graduate student at Boston College, he lived in a shelter for 7 weeks as part of his research for dissertation. And while he was there, he noticed that when he went back, he was surprised that many of the folks he had spent so much time with there actually weren't back there when he returned. And so he was able to kind of pick out some trends of while he stayed there. So he was able to put together a database, the first of its kind, to track who was coming in and out of the shelter system. So when I talk about service data, we're talking about like dates of attendance, names, things like that. And what he learned from his time there, and when he learned about using this administrative data, really changed nationally what we know about homelessness. If we go to the next slide. And so some of the key findings, which you probably are already familiar with, is that by using this integrated data, by using, again, this service data, this service delivery data, we were able to figure out that it's cheaper to house someone than to provide emergency services. And this common knowledge is now known broadly and is a perfect example of how integrated data is used as a preventive message. And I'm sure that this, for many of you all, this is very familiar. So this is what we mean when we talk about how you can use this integrated data to kind of help you to figure out questions to these bigger policy questions. I'm gonna turn it back.
Well, here's just a helpful way to see that another way, a little bit more directly, right? What we often hear about homelessness is aggregated data, right? How many individuals are served by a shelter, how many people are experiencing homelessness sleeping in an encampment. Those are aggregated up, right? But we know that there are individual people behind each of those numbers. And so we use those individual data points in data integration to look at people across systems, right? So if you think about this green diamond as homelessness, and you look at the orange triangle as someone who is accessing public someone who's a student in a public school, that would be a way to know that they're McKinney-Vento and we have their information from the public school system. We can find that person in both systems and link them and see their service involvement, right? And we can see what happens to them across the lifetime, across different services as they move in and out. That's sort of the biggest picture version of what data integration looks like. And we focus so much on this kind of research because we know that understanding multi-system involvement is what allows us to improve policy in a really meaningful way and bring community into that work, right? Bringing this data together is what allows us to understand complex needs across systems, breaking down those silos that Ashley was talking about, allocating resources most efficiently, getting more upstream, getting to those preventive kind of services, seeing the long-term impacts, and engaging across that whole process in shared decision-making about how data should and shouldn't be used, right? Not every data use is going to be a good one. And that's also a big part of, the work that we do at AISP around governance, which we'll talk about in a second. But I want to just explain how our work is grounded in a network of folks who are doing this every day, right? Our main work at AISP is to support a network of sites that are using integrated data to solve social problems, to understand the complex social problems like our $1 Million Murrays, right? And the folks that are highlighted here, this is a little bit of an outdated map, right? We have about 38 sites, but these are the folks that we learn with and we learn from, much like you all do in this room together. And it's what informs our work so that what we produce is relevant, it's actionable, and it's effective. And importantly, we take a developmental approach to this work, right? We know that not every site starts with integration across the lifetime. We know that some sites start by just integrating data across 2 different data points to see how people move in and out. We know some people start with one clear project goal and not the intention to build a whole system. So what we know, though, is that the way that you move up, right, the way that you grow is when you are in community with others and you are learning from others and you are rooted in community and doing things that are going to make an impact long term. So we're going to dig into how we do that, right? And how we do that well and ethically over time. And I, again, want to be clear about what that means in the AISP context. We don't focus on the super fun stuff, right? The bananas, the analysis, that's not what we're usually doing. Really, our focus is on the CALE, right? CALE is data governance process, legal frameworks, the data cleaning, the linking, the standardizing, right? So that data can actually be used to create insights that drive change, and that it's done in an ethical way, most importantly. So today, what we're talking about is like how to help you eat your greens, right? How to do it and make it a little bit easier. So we're going to walk through what guides ethical use of administrative data and touch on how to bring community into that. So yeah, Deja, back to you.
Perfect, thank you. And so we actually had a good question from Chad in the chat that asked about VAWA, the Violence Against Women Act, and the sensitivity around how are you able to even share that, because there's a lot of confidentiality and restrictions in VAWA. And so that's a great question, and that kind of relates to data access. So when we're talking about data integration and data sharing, the type of data, there are mainly three categories. So there are categories that we consider to be open data. So again, that's aggregate data that you can maybe find publicly. That could be something that you get from a public dashboard. Again, they usually exist in open data portals. The data that was used in the $1 Million Murray analysis dealt with restricted data. So data that can be shared, but only under specific circumstances with appropriate safeguards. And then finally, we have a category, what we view as unavailable data. So data that cannot be shared. Maybe there's some data quality issues or should not be shared because of maybe sensitivities. We'll talk later about what the data under VAWA would be, but it would be somewhere between the restricted and unavailable data. So that's what we're talking about when we are talking about data access. And most of the data that we and the partners that we work with live in this yellow area of data that you can share, but it's under specific circumstances and it has to be in alignment with the law. Next slide, please. So I want to begin talking about our framework and how we think about these. And again, we are singularly focused on ethical data. And so we have 4 questions that kind of shape our thought processes and what we recommend is a framework when using data. So we always start with, is it legal? Which for us is the lowest bar. The next question we like to ask, and we like for our partners to ask, is this ethical? So even though it might be legal, it may not be ethical to use. Is it a good idea? How do we know and who decides? And we've also linked a resource there if you're curious to get more guidance about that. So with the first question, is this legal? And that's a lot of what my job is. I get pulled in to kind of help folks figure out, is this legal? We really view this as the lowest bar. So when you are looking at data sharing and integration, a lot of that is going to be guided by your legal authority. And this is what we have identified as the 5 bases for legal authority. So you might have some legislation that's specific to you. So that might be HIPAA, FERPA, VAWA, that you might have some state-specific authorizing legislation. You might have an executive order. For those of you who were familiar, President Biden during COVID issued a couple of executive orders to kind of help data flow more freely. There are policy and rules. And then finally, there are contracts. So if you are part of groups that are sharing data, most of those are facilitated via data use agreements. What you don't see on here are case law or opinions, and we view that as judicial interpretations of these legal authority. But all of these are going to guide how you can share the data, what circumstances, what permissions you need to get. And this is, again, the lowest bar, but it's a question that has to be addressed from the beginning. The second question that we like to talk about is this ethical? And so when we talk about ethical, we really ask for people to think about something called social license, which is basically the public approval or the public perception of this data sharing agreement. And we talk about the importance of carefully weighing risk versus benefit. And I'll talk more about this risk matrix, but this kind of shows some common ways that data are shared and integrated, and there's certain types of uses that we consider to be a bit more high risk with a lower benefit. So those tend to be more problematic use cases, which are highlighted in red. And then on the other end, there are things that have a high benefit and low risk. So, and by low risk, meaning there's a low legal risk of like re-identification or security breaches, or risk in terms of like, let's say in the context of someone's seeking a protective order, that's a bit more high risk because again, if that address got out, that could be some safety concerns. So this is an example of how we map the risk versus benefit of a particular use case of when you want to share data. The next question we talk about is this even a good idea? Are there available data to answer this question? If we did, do we have the resources to respond to this answer? Can these data be acted upon? What action can be taken as a result of this analysis? In our experience, there are countless examples of data integration projects that are legal and they're ethical, but they're not great ideas. So we see this as a very important question to also consider. The next question involves data governance, and data governance are the people, policies, and procedures that support how data are managed, used, and protected. So basically, this question involves who do you have at the table deciding whether this is a good idea? Who are your partners that have an equal say? Are the people who are represented in the data, do they have equal power in decision-making about how these data are used? And in our view, strong data governance provides clarity around decision making, and all of these decisions should be purpose, purpose, value, and precision, should be collaborative, should be iterative, and most importantly, should be transparent. Like, it is really, really important to get buy-in and social license from the folks who are represented in the data. And this is just, again, a little bit more about the data risk matrix. We view governance as, this is how you know you're operating in the green. You're weighing the risks and the benefits. And if you have good data governance, you are operating in that green area. Perfect. So now we're going to talk a little bit about what does this mean in terms of violence prevention in this landscape. So I want to begin with talking about the Violence Against Women Act. Let me go to the next slide. So most of you are probably familiar with this, and this federal statute is the main mechanism that provides funding for housing, legal assistance, and other supportive measures. This VAWA is the reason that it's usually free to file a restraining or protective order. And as was pointed out in the chat, VAWA protects the confidentiality of personally identifiable information. So again, it would protect name, addresses, anything that could identify a person seeking services under the VAWA Act. But the main thing to note is that the Violence Against Women Act is incredibly restrictive about what can and cannot be shared. Next slide. And so I put VAWA in the middle. So the next slide, I will talk about legally the circumstances under which you can share personally identifiable information under VAWA. But our personal stance is that the risk is pretty high with that type of data. And so we like to look at other type of data that can be used, mainly going to preventive ways that data can be used preventive before this even happens, before we get to the point of violence. And Emily will talk about that use case. But data under VAWA tends to be in that red, yellow area. Again, data under this act can only be shared under pretty limited circumstances. So you got to informed written consent, and the statute outlines like specifically what that needs to include. You can share aggregate de-identified. So if you wanted to share like a percentage, you could, or the other way that it can be shared is under some judicial or legal process. So it can be shared if you had got a court order or mandate or subpoena, and it's only for very limited purposes. That's usually for related to getting some type of protective order or for use in some type of civil proceeding. So unlike other statutes like FERPA or HIPAA, which allow data to be shared more readily, the Violence Against Women Act is very narrow in how data can be shared, and for good reason, right? We want to continue to protect the confidentiality of folks seeking protection. And so for that reason, the data selected in this context might not be as useful or a little bit riskier to use. So we actually like to look at other data that impacts the social determinants of health, right? The type of factors that play into why violence began in the first place are probably better places to start than the service data collected under VAWA. Oh, you're muted. Sorry. Go ahead, Emily.
Thank you. I was so confident I was going to remember to unmute. Thanks, Deja. Yeah, so as Deja was saying, there's so many different factors that tell us about the community conditions that influence violence, different kinds of violence. Of course, we're talking here about intimate partner violence, domestic violence. But the example that I want to walk through is of a program evaluation, and it does use service usage data, but it really goes to show, it really helps illustrate, I think, the value of having service provision data and being able to connect that to administrative data. It demonstrates how that can work together, but then also what we can learn from administrative data and a lot of the questions that we can ask. We also thought a program evaluation example might be useful to this group, since that's a lot of what y'all are doing already, and this will be familiar. I'm also always glad to talk about an example in where I live. So this evaluation is a really interesting one also because the results are not the kind of thing that you'll be like waving, your hands up in the air in excitement about. It's a homeless encampment. It was an attempt to clear 2 homeless encampments in the Kensington neighborhood of Philadelphia, and to connect people to different services. And the results were not what the city had hoped. And there were a lot of really important lessons that came out of that. And so it's a really interesting evaluation from that perspective. So let me back up and lay the groundwork. So the city of Philadelphia funded a team of researchers from Penn School of Social Policy and Practice, where AISP is housed. And it was part of this initiative to wind down 2 encampments in the Kensington neighborhood in 2019. And the closures were part of a citywide effort to combat the growing opioid crisis, which is a crisis that continues today. And the hope was to connect people who were using drugs, people with addiction, to housing and substance use treatment services. There were sort of 2 groups of folks involved in the sort of data side of things, right? The analysts at the local integrated data system here in Philly, and then the evaluation team, right? So the analysts at that local IDS, they linked service record data from 6 different agencies that were already contained within that system to a list of what's called a by name list that was prepared by folks working on the ground. So we had the administrative data from 6 different services. So things like homeless services, mental health agencies, the health department data, linking that to the names of the folks we knew were living in these encampments, right? And that gave us a sense of who was eligible to receive services under the Evaluation Resolution Pilot, or ERP. That's the Encampment Resolution Pilot, which is what this was referred to, the ERP. The evaluators themselves received aggregated results from the record linkage, right? So that they could evaluate the extent to which the target population, which is the people living in the encampments, had received housing and substance use services prior to, during the pilot, and then in the 4.5 months after the ERP, right? So we had that what was their pre-experience with these services? What kind of services were they connected to during the encampment clearing? And then what happened in the 4.5 months after the pilot. And so evaluators themselves then also decided to take this aggregate analysis and supplement that information with interviews and surveys of different stakeholders. So that meant people living in the camp, folks working with folks in the camps, and people in the surrounding neighborhood. Also talking to folks who worked in the city, evaluating city meetings about the ERP, examining local city records, and following media coverage, which gives you kind of a sense of the tone of the local community, in order to get that really holistic picture of the ERP impact. So the final report provides, an examination of the outcomes for the folks who were moved out of this encampment. So that was how they fared 4.5 months after the resolution, the impact on the broader community, what were the outcomes for the Kensington neighborhood, and then also thinks about what are the key findings or what are the key lessons that we've learned from doing this work based on sort of all of that information and all of those different experiences. So I wanted to pull out, you can read this report, right? It's publicly available. We'll make sure to get a link if that hasn't been dropped already. And but the pieces of this report that I really wanted to bring out are how the sort of survey and qualitative information were brought together with administrative data to paint this holistic picture, right? This is an example of what we can see about the people who were intended to be connected to treatment. What level of involvement had they previously had, and what level of involvement did they already currently have with homeless services, right? It's really easy to sort of look at people who are living in an encampment and sort of say, well, we just need to connect them to treatment. And administrative data really paints that picture of, a lot of people are already connected. So there's another point of intervention or a different type of prevention that needs to happen earlier on. So that's a really helpful look at those folks. They were also able to look at these numbers across drug use treatment, incarceration, people who are previously incarcerated, that being, of course, a barrier to housing, mental health diagnosis, mental health service usage, both past and current again, and understand the complex needs that the folks living in that encampment have, and then knowing what our task is in terms of writing policy and providing services, and also thinking about prevention, right, for folks coming from different services. And thinking about the sort of tail of the work that we mentioned, there were established data sharing agreements, and already like data integration protocols established before this evaluation took place, right? So there were stakeholders at the table who were able to sort of talk together and decide if this evaluation felt like a good idea, if this information, if working with this vulnerable population, taking a list of their names and connecting it to administrative data, if that was a good idea, right? They knew it was legal, and they had to go through those questions of, is this ethical? Is this a good idea? And will there be an impact? And so, you ever do that thing where you move your mouse and all of your screens disappear at once? I just did that. So then we get to the lessons learned, right? What was the impact? So those by name lists, right? That's what BNL means, the list of folks who, people who are working in the encampments, got everybody's name. Those were essential in crafting recommendations, right? And providing lessons back to the community, to city leaders. This graphic or screenshot really demonstrates who had somewhere to go after the encampment was shut down, right? Whether that service connection was successful or not. And the number of no placements and unengaged are high. They're really like way too high, right? And so evaluators could really focus their recommendations and lessons learned on the areas that did drive placement, right? So we can learn from what worked and why, so that we could say, are there particular populations that this didn't work for? Why not? What are the barriers? And that it could also help think about, what are the like broader barriers, right? Thinking about prevention, what are the upstream things that we can think about, right? What is local resistance to new housing options? What does that look like? What is the contrast between short-term solutions and long-term care needs? What does that look like in relationship to these numbers? And what is the importance of coordinated care systems and having access to those coordinated care systems for a long time, regardless of things like health insurance or citizenship status? And another piece that I really want to point out is that while these numbers of folks who were unable to access placement or who had no ongoing placement but were still in contact, what really is important to me, right, as a member of this community, is that I know that those people are accounted for. I know that they are that they are on that BNL, right, and like that they are still in view, right? So often what happens, as we all know, is vulnerable populations sort of fall off the list or fall out of focus because we're really scared to talk about these numbers. We're really scared to put these numbers sort of in front about who we're not able to access. And when we connect with administrative data, we find a way to connect with those people, and we try to shine a bigger and bigger light on the folks who need services most. And so that's also, I think, a heartening piece of administrative data working together with program data for evaluation. So I will pause there because there's a lot more that we can talk about in regard to this report or about data integration. And I think it's time we turn the mic over to you for a little Q&A.
Thank you so much, Deja and Emily. Yeah, we'd love, I feel like I have so many questions, so I'm sure people in our audience do. And we'd love to be able to take advantage of having you both here to get some answers. So questions that are coming up for you all, feel free to put them in the text chat. Janae and I are looking at that right now. I think that a couple things that you shared. So many of us doing violence prevention work, we are looking at community conditions. We are looking at like risk factors. And so the way that I'm thinking through some of how data sharing and integration may support our work is through being able to access some of those data integration systems. So not necessarily that we have data to input, but is it possible that we could still access some of that? Could we still be part of that like collaborative of sharing, I guess is a question.
Yeah, that's a great question. And so it depends, right? So yes is kind of the best answer. And we actually have a site in Charlotte-Mecklenburg, North Carolina, which is where Deja lives, that's doing this right now, is doing a violence prevention program, which I'll let Deja speak to more. But what's really exciting about more and more data integration efforts focusing on equity explicitly and focusing on community engagement explicitly is that we're hoping to see more of these, local organization collaborations with the data systems themselves. A lot of these systems are based out of, the executive office in a government or a county, a county level office or even a university. And so it depends on how much that host organization is connected to those other organizations. A lot of times it'll be like a really tenacious researcher like Dennis, right? Our co-founder, who we talked about sort of being like, I need access to these data because I want to help this program do this deeper evaluation or understand something better. And so it's about those relationships, right? But it's definitely something our sites are working toward. And Deja, if you want to talk about Charlotte.
Yeah, so we have a initiative going right now that's called the Equity in Practice Learning Community. And I'm sorry, I can't see myself, so I don't know what I look like. My Zoom got weird, but where communities applied to be a part of a cohort, to learn from other cohorts about how you center equity in data collection, data integration. And one of the sites that we have, thank you, Sky, for throwing it. She dropped it in the link for you all if you wanted to check it out. One of the local governments that applied and received it, and that's part of the cohort, is Mecklenburg County. And they are actually doing something really cool. They've created a violence prevention a violence prevention committee, if you will. It's called DAYROC. And so they have a bunch of community partners that have come together. So criminal justice partners, the city has come together, the sheriff department, the school district. So they have like extensive data holdings, and they are using these data to examine, again, the root causes of community violence. And they've created just a committee to kind of figure out like how to best figure out like the data use licenses, what data to look at, and it's really, really cool. And I think that's a great example of how, if there are not data that you cannot access. So for example, I think they at one point they had wanted to access data related to juveniles, and because of our state law, they couldn't. Having access to these other data holding and these other data partners still help them to be able to answer just very important questions. So to Emily's response, it definitely depends, but there are some workarounds, but a lot of it is around, building these relationships and getting plugged in with these other community partners.
Also, just add one other thing to that, which is something that we've seen change, and something we're excited about that we're seeing more and more in our network members is adding to their governance structure community representatives within the governance boards themselves. So both local organizations and folks who represent the general community having more of a seat at the table to determine priorities, to think about what projects would be a good idea, and to just be more involved in the life of the integrated data system.
Thank you both so much for that. I did see a question in the chat from Wendy, I think referring back to the Philadelphia work that you talked about, Emily, asking if with the data that came out of that work, did the funding change?
Yeah, Wendy, that's a wonderful question. And I think in an ideal world, the funding would have dramatically changed. But what we saw was that there was a pause on future sort of pilots to clear encampments. And instead, where services were directed, were supporting people where they're at, right? Which is for many of those folks living living on the in the encampments. And we also did this evaluation in March 2019. And we know change moves slow, funding moves slow, and it moves a lot slower when a global pandemic hits. And so one of the things that really changed was the response to homelessness in the city of Philadelphia. We saw unprecedented levels of federal funding to house people immediately and in hotels and in single occupancy rooms during the COVID pandemic. So a lot of what we learned from this pilot now we have to recontextualize sort of in this post-vaccination world. What does homelessness look like in Philly? A lot of the opioid crisis has shifted in what that looks like. And so there just now have to be kind of different evaluations. But we have seen more funding for rapid rehousing, more funding for certain kinds of shelters in the city. But unfortunately, it didn't lead to direct services to those folks.
Thank you, Emily.
That's a great, I'm sorry, I just wanted to respond to the question of how do you ensure safety in case of an IPV, intimate partner violence survivor, and giving them a seat at the table of data governance? That's a great question. I'm not sure that there's any known answer. There are definitely things you can do about confidentiality. You can figure out a way to whoever your data governance committee is, you can keep that sealed. I'm not sure that there's a good answer. I think the important thing though is that you have to figure out a way to make sure those voices are there, right? I think that sometimes, and that we have seen numerous examples of what happens when you decide to share data and integrate data without getting social license and buy-in. Most prominently, they have been with school districts that have opted to share student data with police departments, and communities, rightfully so, get very upset about that when you don't bring in parents and communities about that. And so I'm not sure I have a good answer about how you ensure safety to do that, but I think it's necessary. I don't think that you can actually get any good work done without having input and power sharing there with IPV survivors. I don't know if Emily have anything else to add.
Yeah, thanks, Deja. I also really like Melissa's comment is a really great one. That there are also other ways to involve with the voices of survivors beyond being at that sort of table every day and voting on minutes and participating in the agenda, right? But it also comes back to the research design and the projects that happen with the integrated data system, right? So when we're doing data collection, not letting that end at administrative data, but thinking about what is community participation in this project look like? How do we bring stories and context into this? And there's we could do a whole 2-hour presentation on just survivor safety in, community participatory research about how do you solicit stories in a way that allows people to feel empowered, that protects safety. And so I think I'll just kind of leave it there, that there are increasingly integrated data systems that are thinking about qualitative approaches, thinking about things like data walks, different ways to represent stories, so that we're not just looking at numbers, and that becomes an integral part of any project that comes out of a data system, that it's never just reporting, but that it's always contextualized with lived experience.
Thank you so much, both of you, for that answer and sharing your insights on that. Janae, I saw you had come off mute a few minutes ago. Did you have something that you wanted to add?
Oh yeah, thank you. I was also going to uplift a question in the chat, which you beat me to. I have 1,000,005 questions on my own, but I also am seeing Jennifer, which honestly, Jennifer, thank you for asking, because I feel like this comes down to one of those things that I just pretend that I know what something is and I don't. But could you talk to us. What is a data walk for those of us who haven't heard that term before?
Absolutely. I'm also going to drop a great example of a data walk that just happened in Hartford, Connecticut. So a data walk is a great way to invite people into looking at a series of data or stories sort of in a way that is interactive and that allows people to go at their own pace and sort of have their own response to data. So it can look a lot of different ways. Sort of the most common one is putting up sort of like a series of posters and images and things that tell the story about a project that was done and sort of building on learnings, right? So like, for example, in that evaluation, first we see the stats about people who had experience with a homeless service provider before they lived in the encampment. Then we saw that there were people who had services during the encampment and then afterward. So each of those would be sort of their own visual representation within a data walk. And there would be people, you know, around those posters able to talk about what's happening. And it wouldn't just be numbers, right? Maybe there would be, if someone consented, their photo and a quote from them talking about their experiences. Maybe there would be some, detail about what does it look like to receive services from a Philadelphia service provider, right? There'd be these different ways to get into the experience of what the numbers mean, the people behind the numbers, as well as giving you that like aggregated information. And so the reason I sort of bring that up as a way to think about safety is that that allows the people who are represented within the data to have a say at each point about how the analysis will be presented and how they want to be represented within it. And it's also something that survivors can choose to attend, not to attend, speak at, not speak at. It's a great way for communities to be engaged and people to feel really empowered over what's being learned from their stories and that they're not just being marked as a number. So there's lots of different ways to do data walks, but it's a really a beautiful way to involve people in the data, data collection, analysis, and then dissemination process or reporting.
And I wanted to go to Chad's question about, so his question is, do you have models or recommendations for engaging individual survivors directly? But before that, it was VAWA creates obligations for victim service providers, but it doesn't restrict survivors from choosing to share their own information. So I can speak from a legal perspective. We just drafted a report about like what ethical and informed consent can look like. And I'm happy to drop that in the line, because again, one of the ways that you can share that data is if you get informed consent. So I'm happy to drop that. That might be helpful as you think about like ethical ways to get that consent and some considerations that we can absolutely drop in and share as it pertains to the legal part of engaging with survivors if they wanted to share information.
Yeah, and for the engaging survivors directly, I would say I'm hesitant to make a recommendation just because this isn't a field that I've been directly involved in for a long time, and it's also not a place where any of our sites have really developed expertise yet. But I will say that community participatory action research, which is often referred to as CPAR or PAR work, is a really rich and growing field of academic research that is not limited to academics. It is very much meant to bring anyone into the process of understanding information and then analyzing that information and then putting it back out into the world in a way that's really digestible and useful. And so I would say, any CPAR work about, violence prevention is a really great place to start, or engaging survivors is a really great place to start. And I can definitely ask about that around sort of folks who've done this work and share that back with Ashley and Janae to send that back to you. But I'm hesitant to recommend something specific now, but I would say that field is a really collaborative one. There's a lot of spaces like this where it's people talking about what's working well, what's not working well, what can we do better? And I think that humility in academia is needed and really, encouraging in that space.
Thank you. And I see another question from Angela. Do you have any strategies for improving data quality when quality is associated with billing? Thinking about healthcare settings where intimate partner violence may not be picked up by codes used for billing insurance.
Yeah, data quality is a super tricky place. Deja, I saw you unmuted. I don't know if you have a
Yeah, no,
legal.
I was gonna say that's a little bit, I think, outside of the scope of our wheelhouse. Like we look mainly at like more broadly towards like policy issues. Like we don't do too much with like service delivery ourselves, but there are a bunch of partners who are in the thick of the service delivery part that would speak to those quality issues. I'm trying to figure out so I can drop it. I'm trying in my mind, I'm like, the name is escaping me. But I'm gonna see if I can try to, maybe it's the data trust. Let me think about that. But generally, we do have, if you wanted to check out our website, we do have like resources that talk about, we have a whole quality framework and just considerations when you're thinking about data integration. I'm not sure how helpful that would be just because we're not that thick in the woods with it. But I would absolutely recommend that you check out our website. And I'm going to try to see if I can think of that partner who deal more directly with the type of question you're thinking about, which relates more to like service delivery.
Yeah, and healthcare settings in general are really tricky because of private insurance, right? And so a lot of that is so state specific, like how billing can look. But there are a lot of sites, as Deja was mentioning, that use claims as part of their linkage. And so there are resources that are related, but I don't know of any that specifically address the actual coding for IPV.
So I saw Karen's comment about there's so many links today. Yes, this is a really rich conversation and lots of links being provided. We'll make sure that we do a summary of all of the links so you all have access to those as we move forward. Deja and Emily, I really want to thank you so much for joining us and sharing about the work that you all are doing at AISP, thinking about these issues with our audience and answering these questions. Again, for all of you who have joined today, this is really was meant to just like, let's learn about something that we might not be thinking about or have a lot of experience with, and think about the possibilities, how this might, help us advance our work in prevention. I think there's so many creative people in this room. And so I'm sure that there's some really great ideas coming out of this. Janae, I want to just pass it to you to see if you had any closing thoughts.
Oh, good question. I was taking notes about ideas that I had as well. Maybe just one closing question actually for you, Emily and Deja. I am loving all of everything that's happening in the chat and all of these questions. And I think Ashley touched on this a little bit earlier. And I'm also wondering if there's anyone like me in the audience who is like, this is so cool. I would love to do this stuff. Also, this is the first I'm hearing about data integration. Maybe I'm a local rape crisis center, or I saw earlier someone mentioned that it would be great to have data on the need for alternative justice systems. If someone is hearing this and has this passionate idea but doesn't know where to start, what are maybe some of the first steps of getting the ball rolling and kind of building to something like the incredible work that you're doing?
So I just dropped, and I'll also let Emily pipe in. I just dropped a link in there that talks about just introduction to data sharing just generally. So that could be a good place to start, to just even just think about like this big world, like where's the best place to even begin. We're really good about citing folks. And we hyperlink a lot of resources. So if you're just trying to think about like, I don't even know where point A is, we would absolutely recommend that you start with that link. We have a whole resource library, but that's a good just first place to start, because it'll hyperlink you to places and might give you like questions to think about. I know when I started, I was like, I don't know what I don't know. Like, I don't know what questions I'm missing because I don't know what I don't know. And so like, that could be a really good place to start. And I'll let Emily jump in if she has any other thoughts.
Every day I'm still asking that, saying that. I don't know what I don't know. I would say also the other thing, you know, we have that slide about like our approach is relational, and that's also what the most successful sites and folks in this field are as well, right? See what's going on in your community. There's probably some, you know, related project like this happening where you are, or someone's maybe had an idea similar to the one that you have right now. And so just talking to folks and you know, I see so much like resource sharing happening among participants, and like follow those links, follow up with each other. You can follow up with us. I'll also drop the link to sign up for our newsletter, where we're always uplifting the great work that our sites are doing, which I think can be a helpful way too to see if there's something that sparks your interest. It's a great way to see what sites in our network are doing. But I would say, yeah, just I thinking about that relational approach, and that like none of this work is done in data silos or in people silos. And so keeping that in mind as you progress. Yeah.
Thank you. That's really helpful. Well, to everyone who attended, thank you so much for being here with us. Like Ashley mentioned, we'll send out the slides, the recording, and all of these links in all of our follow-up material. And we will also have a brief survey to send out to you all. And if you would like a certificate saying that you attended this webinar, that's the way to do it, by taking that survey. And Ashley just plugged that into the chat.
Thanks, Janae. Thank you again, Deja and Emily. I think we kept you over time, but just so appreciate you being here with us and answering all of these questions. And thank you all in the audience for all of the conversation, all of the resource sharing. We'd love to, as Janae said, hear what you all thought, keeping in mind that we know this was just kind of a new area for us all to explore. But we hope to see you on a future Prevent Connect web conference, and we hope you have a great rest of your day. Take care, y'all.